Okay, sweet. So let me take these out. Okay. Okay, so we'll do the thyroid, essentially full everything you need to know with the thyroid. So obviously we know where the thyroid gland is. It's located in the front of the throat, but it has so many effects within our metabolism, our mood, our cognition, and even hormonal imbalance, and obviously body temperature as well. And the thing is that the conventional model and the way that they think of thyroid is that they just think it's just, in isolation, meaning it doesn't have any, interplay with other organ systems and hormones within inside the body. So what I mean by that is that many people have these symptoms of depression and anxiety that actually come from thyroid issues, but then they would just give someone an SSRI, for example.
Right.
So
Yep.
that's very important to understand that that's how allopathic conventional model is. They're isolating different organs and hormones, for example. They're just thinking about thyroid. And if you are dealing with anything that, are the symptoms of poor thyroid function, they just think that it's not correlated back to thyroid, but, specific analysis will show they will have, they'll either feel your throat for nodules, or they'll feel, they'll obviously do, just an examination and, a chief complaint assessment, meaning what do you come in for? And, they will detect thyroid, and then they'll pull lab markers. But here's the thing, they'll pull just the TSH and perhaps something called a reflux T4, which is reflux means that if the TSH is out of range, the lab will already automatically pull the free T4. Now, no matter what, it's not getting a full picture of what's going on with the thyroid. So obviously, let's get into it. So this is a good example as we lead into this. So they're just testing TSH, but as we see, this is a whole ecosystem here. It starts with your hypothalamus. So your hypothalamus releases something called TRH, thyrotropin releasing hormone. Okay, and then it goes to the pituitary gland in the brain. So these are both coming from the brain. TSH, thyrotropin stimulating hormone. This is the one that gets tested. But this is then messages to the thyroid gland. So that TSH to the thyroid gland message, 95% of it goes to T4. And then about 5% go to T3, which is the active form. But see, now there's 95%. So that 95% then has to activate into the active form. Okay, but the activation does not happen in the thyroid gland from T4 to T3. Some does, but barely any. It happens in the heart, the gut, and the liver. The gut and the liver are huge, and other peripheral tissue. So how it actually creates this hormone, though, is that it grabs iodine from the bloodstream and tyrosine from the bloodstream and creates thyroidine. And then it creates it to this kind it needs. So if you're having iodine deficiencies, you can actually get a nodule. And if you're low in tyrosine, like veganism and things like that, then obviously that will impair thyroid function. Selenium. Selenium works on the deiodinase, meaning it's the activation from T4 and T3. So these are little key minerals that work on the conversion of thyroid hormone. And obviously, what happens then is that it converts into T3, which is the active form, and then gets into the cell for to create energy and all of other biological functions. So let's look at a big picture here. So we have the hypothalamus right here, releases TRH to the pituitary, TSH, then TSH to the thyroid gland. Thyroid follicles release T3 and T4. And obviously that's talking about, I'm not going to get into that, just homeostasis, meaning your body is staying at a, calm place. It's not overactive. But obviously we can see that if it's, if body's not at homeostasis, which about majority of everyone is, if they're sick and diseased, then we can see that obviously it impairs, these T3 and T4. So the thyroid talks to every cell in the body. It talks to your sex hormones like estrogen, progesterone, testosterone, your androgens. Okay. It actually talks to insulin as well. talks to the GI tract. It helps with the motility of the food throughout your body. Because remember, though, your thyroid T3 speaks to every cell in the body. So that makes sense now, right? Because if we have poor T3, then, our cells don't have the enough energy to do these biological functions. So if we look at it abroad here, so if we are under eating, overtraining, and dealing with chronic stress, that's going to, dampen the hypothalamus, which is going to dampen the signal to the pituitary gland to create TSH. But it's going overhead here, but if this is all making sense here. So, hormonal imbalances are going to happen with poor thyroid function, Hashimoto's, obviously blood sugar problems, impaired metabolism, liver dysfunction, food sensitivities, leaky gut, yeast, fungus, dysbiosis, adrenal fatigue, stress, blood sugar. This is all stemming from poor thyroid health. But as we see here, most people take a deductive approach to this, meaning, okay, I have low testosterone, so I'm just going to do testosterone injections. Well, they're not even looking at all these other things that play into this. Or I have a leaky gut. Let me just give you some natural supplements to help with your gut. Okay, we're not looking at all these other things that influence the gut. Same with the liver. And it all goes down to the cell. Weight loss resistance, fatigue, insomnia, metabolic dysfunction, mitochondria dysfunction. So if we're actually looking at what are optimal ranges and then what are the clinical ranges. So we want a TSH in between 1 or 2 ml. That's optimally. And we want a free T3 above 3.2 pg/ml. And a T3 total between, the conventional is fine. Same with T4. And obviously, the antibodies below 60. But majority of antibodies we see are way in the 400s to 600s. And then obviously an iodine anywhere between 40 and 92. Obviously enough iodine, sufficient amount of iodine. So here's some notes though. Mild subclinical hypothyroid is high TSH with normal free T4. That means that this person technically in the books don't have hypothyroid. They're not clinically hypothyroid. They're subclinical. So what happens though is that they take thyroid medication, but they don't need it. So they're going to increase their free T4 because they're going to give them a T4 medication like levothyroxine or Synthroid. So now you're just adding more hormone when you don't need that hormone. Okay. And then obviously classical hypothyroid is high TSH and then subnormal free T4. So majority and 99% of T4 is bound in TBG, which is thyroid binding globulin. So majority, it's like a trap. It's trapped in there. So obviously the free T4 shows us how much is actually able to be converted into T3, which is the active form. And then a little bit here. Okay, so more notes on the lab testing. We want obviously TSH closer to 1. If it's high, hypothyroid, over 1.1 NGDL, nanogram per deciliter for free in total. And then optimal free T3 is above 3.2 pg/ml. And then we want to watch reverse T3. Depending on your lab, the way that your labs are reading below 15 nanogram per deciliter. And I got to think off the other head because there's other labs. But let's get into hypothyroidism. Hypothyroidism is a condition where the thyroid is underactive and not producing adequate amounts of thyroid hormone. This means that T3 and T4 levels are low, slowing down cell communication and processes elsewhere in the body. Obviously, symptoms are weight gain, fatigue, weakness, slow heart rate, elevated blood cholesterol, changes in menstrual cycle because your thyroid actually interplays with all three forms of estrogen. Enlarged thyroid gland nodule, constipation, joint pain and stiffness, dry skin and hair, hoarseness and voice, cold sensitivity. So poor thyroid health has systemic effects, meaning it doesn't just affect, you're not going to get just a hypothyroid. It affects other glands and systems in the hormone, because remember, it's functional approach. Okay, if your blood sugar's off in the doctor's office, they're giving you metformin, they're not going to look at your thyroid gland. Your gut's off, they're not looking at your thyroid gland. This is why functional approach is needed in healing and optimization. Okay, so obviously, abnormal thyroid function can decrease bone mineral density. So meaning you don't have enough calcium in your bones. Obviously, that creates the stage for osteoporosis and all other of those, bone conditions, whatever you want to call those. Top of my head, I don't. Gut health. Low thyroid function can slow the motility in your intestines, your large and small intestines, and then obviously hinder the absorption of nutrients that happen in your intestines. So majority of your nutrients are absorbed in the small intestine. So if you don't have adequate small intestinal health, meaning your intestines aren't working optimally, you're not going to absorb all the nutrients, so you're going to become nutrient deficient, which then circles back and then hinders the thyroid too, because you're not going to have iodine, selenium, and all those. Obviously, when the thyroid is working optimally, though, it dampens gut inflammation. And then obviously, if there's low thyroid function, you can see gastric, meaning you're not getting enough. You have too much stomach acid, and then you could get leaky gut. The intestinal lining gets impaired, and even dysbiosis. Obviously, your thyroid hormone affects your sex hormones, so you'd have low libido. And then obviously, hypothyroidism in men is linked with erectile dysfunction. Obviously, low thyroid hormone slowdowns ability to break down fat. Obviously, it impairs metabolism on the mitochondrial level. Obviously, going back on the energy, blood sugar, lipid panels, adrenal, toxics, estrogen dominance, cognitive issues, hair loss, and temperature dysregulation. So, some more notes on the hypothyroidism. Over 12% of the U.S. population develop a thyroid condition during their lifetime. Up to 60% of individuals with thyroid disease are unaware of their condition. Hypothyroidism is the second most endocrine disrupting disorder, obviously endocrine disorder affecting women of reproductive age. The most common cause of hypothyroidism in the U.S. is Hashimoto's. So this should be noted here. Around 90% of people that have hypothyroidism actually have Hashimoto's, but they don't know this because they're not testing their antibodies or doing a thyroid ultrasound. So they're taking medication. All the doctors suggest, because the medication isn't working for them, they don't feel well, to get another medication or to up the dose. When the reality is the immune system attacking the thyroid gland. Has nothing to do with the thyroid. The thyroid's the culprit. This actually happens more often than not. And this should be noted because 1 in 8 women will experience a thyroid issue in her lifetime. Now remember, let's look at this. Root causes, okay? Because you don't wake up one day with a poor thyroid function unless you were born without a thyroid. Okay? So stress could impair thyroid function. Obviously, stress brings inflammation. Inflammation brings regeneration, but with too much inflammation brings issues like this. Obviously, stress hormone can block the conversion of T4 into T3, which we need T3, and increase the production of reverse T3, which is what we talked about earlier, the RT3, which they don't test this either. But usually RT3, reverse T3, means your body is stressed. If that's high, that's stressed. Food intolerances obviously can trigger immunological responses, going back to Hashimoto's and hypothyroidism. 80% of your immune system is housed in the gut. So if you're dealing with Hashimoto's disease, obviously that's going to impair the thyroid gland, but then also 20% of T4 is converted to T3 in the gut. So an imbalanced, unhealthy gut microbiome will affect this process. If you have like a dysbiosis in the gut, or if you have a leaky gut, then that conversion can't happen, because remember, it doesn't just happen in the thyroid gland. And then obviously these infections can trigger Hashimoto's. Obviously, nutrient insufficiency or excess. Obviously, inadequate iodine, selenium, zinc, iron, and vitamin A can impair thyroid function. And then excess fluoride and iodine can damage thyroid cells. Fluoride coming from tap water and different products that you may be using. In Hashimoto's, deficiency in vitamin D has been linked to poor immune function. That's why everyone suggests vitamin D if you have Hashimoto's. Obviously, why your thyroid function is low, you have Hashimoto's. Obviously, if you have no thyroid, you obviously have low thyroid function and you need medication. Toxins impacting thyroid, pregnancy and menopause. Producing thyroid antibodies before and during pregnancy. Estradiol reduces iodine uptake and increases TBG, so it's trapping more of your thyroid hormone, reducing free thyroid hormones. Other medications can impact thyroid hormone production. Off the top of my head, I'm not too sure, but after some research, I probably can find some. Off the top of my head, though, I can definitely see that, like metformin, statins, ACE inhibitors, calcium blockers are all impacting thyroid function, which are medications. And then obviously reduce absorption of thyroid medication. So if you're taking, other medications and then you're drinking a bunch of stimulus and you're not sleeping enough and you're overstressed, this is why your thyroid function is low. So how can we actually fix this? But you're in the program, so you're obviously going to fix it. But, a root cause analysis, why? We need to find out why your thyroid's, in dysfunction. Majority of the times it's, obviously poor gut health, inflammation, toxic overload in our liver, and stress. Those are the main bullet points. So if we address all these, well, we get a full reading on the thyroid, we can figure out what's really going on. From there, we can use specific supplementation depending on what needs to be addressed. Inflammation, some gut microbiome help, some adrenal function, HPA access, adaptogenic support for stress, some phases of liver detoxification, which we all do this. We do this. This is why you feel good. You lose 10 pounds in a week or whatever. All right. And then obviously lifestyle choices, exercise, stress management, smoking, and alcohol. So here's some things that just help with, the nutrients bound for these thyroid conversions. Vitamin B12, obviously coming from grass-fed beef, egg yolk, salmon, organ meats. Magnesium, dark leafy greens, nuts and seeds. Zinc, coming from grass-fed beef, lobster, oyster, nuts, and seeds. And then optimal T4, iodine, vitamin B12, vitamin C. T3, we want zinc and selenium for the activation and synthesis of the hormones. And yeah. There we go. Some extra notes, though, on thyroid would just be looking at what I was saying, a full thyroid panel is needed. Is not always needed if you can address these things first. That's story for enough time.